Eskom has announced that Stage 3 power cuts will continue from midnight until Thursday. Stage 4 load shedding will, however, be implemented during the afternoon, that's peak, from 4 p.m. until midnight daily. At the same time, load shedding is reportedly causing havoc at healthcare facilities in the country, prompting a call from the SA Medical Association for hospitals to be exempt from these schedules. For more, we can speak to SAMA chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, always good to have you on Newzroom Afrika. Give us a very practical indication of what happens at a hospital when we do see this escalation in the level of power cuts.
Good evening to you, Tembegile, and your viewers, and thanks for having me in your program. Now, if you look at the hospital, you'd understand that there are different levels of sickness of people who attend hospitals. Some, they come as emergencies, and some, they need emergency operations. So those patients that need emergency operations are the ones that are worrying us, because you will understand that whilst you're preparing to take that patient to theater, there's no electricity. Or whilst the patient is already on the table, the electricity goes off. And that's not the only problem, but also patients who need cesarean section, an emergency cesarean section. So those patients as well, they may complicate if you have a problem of power cuts. The other problem is not only to the patients, but also the products that we are using in the hospitals, like your vaccines, your insulins, that needs to be always in a cold storage. You'll find that if there are power cuts and they take too long, especially if you have got high levels like level 5, level 6, they get affected and they become less potent. They cannot be effective. So those are the challenges that we are really facing. Also, not also sparing the children, those that are born prematurely. They need to be kept in the incubators. Those incubators are made warm using energy. And if you have a power cut that takes that long, it affects directly the life of that infant.
Are there clear examples, Dr. Mzukwa, that you've been made aware of, at least in the last few weeks, especially with the escalation to up to Stage 6 power cuts, where it can be proven or argued that the condition of a patient deteriorated or even resulted in death as a result of a power outage, a power cut instituted through load shedding?
Well, we released this statement because of the pressure that we got from our members. I'm very, very sure that if we are to ask for such cases, we can produce such cases, because we not only got this from our members, but also members of the profession. You would understand that Prof. Mohammed as well had started a petition to say that let us not have hospitals having power cuts. So I am very much certain that if we are to be asked for proof, because it's not just a statement that came from SAMA, it is our members who alerted us that there are complications because of these challenges.
Practically, how well does the generator backup system work? Are there instances where it works better than most? And I wonder, for example, in the more far-flung parts of the country, if those facilities, especially when you look at clinics, would have emergency generators on site.
Those generators, at times they work, at times they don't work at all. They are not well maintained, they are unreliable. And you can imagine that if it happens in the urban areas, how much more in the rural areas? Because in most cases you find that those are non-existent in such areas. In the clinics, usually there is no backup. They solely rely on electricity that is provided by the municipality or by Eskom. So at this point in time, I can assure you that there's lots of medication and vaccines that are going to be discarded just because they are not, they've lost their potency.
So now you've got that added dynamic of waste, right, in an environment where hospitals are already told that there's so little to go around when it comes to resources.
I can't hear you.
I was saying, Dr. Mzukwa, what that does now, you were just talking about how refrigeration, for example, for vaccines may be compromised. It leads to an issue of waste of crucial resources at a time when the healthcare system is already having to go by on so little when you can look at the budgets.
Yes, Tembegele, you are spot on, because as we speak, the healthcare system is buckling under pressure due to shortages of resources, broken equipment and all these things. When you have these power cuts, you will recall that what happens is that when the electricity comes back, it damages, the surge damages the equipment, and making it, impossible to use such equipment in the future. And that, adds on the problem that is already existing, where we have shortages of resources. If you have vaccines that are not effective, or that are no longer potent, or insulins that have been damaged, you can understand that goes to waste. It's not going to be used to any patients by healthcare professionals.
It's easier, I suppose, in this instance to identify cases where healthcare has been compromised as a result of the power cuts. I'm curious. Well, in fact, I would imagine, and I don't know if you'd agree, that it would perhaps be more difficult to quantify that when you look at people who are at home, who need oxygen, for example, people who've been sent home by facilities to transition peacefully in the comfort of their homes, how they too may be affected.
Yes, it's at this point in time, it's going to be difficult to quantify it. But, we only rely on the anecdotal information that we get from our members. We keep the records of the complaints that we get, and surely, the number of complaints would surely prove that this is impacting negatively on the healthcare system. But it is very important that, government does not take this thing lightly. We need to make sure that no death occurs that could have been prevented. So we need to make sure that, we spare hospitals from these power cuts and this load shedding.
Thank you so much, Dr. Mvuyisi Mzukwa, with the SA Medical Association, chairperson of that organization, talking to us about the impact of load shedding on the healthcare system.